Good day, my name is Meljude D, Bocobo, student nurse from Nueva Ecija University of Science and Technology, BSN-3C. And for today's video, I'm going to perform surgical hand washing.
Surgical hand washing requires the removal and killing of transient microorganisms and substantial reduction and suppression of the resident flora of the surgical team.
For the goal, to reduce the number of microorganisms on the hands, cross-contamination and transmission of microbes and diseases. And then for our equipment, check for soap, water, running water, and then paper towels. And then for our implementation, first, nails should be kept short. Most agencies do not permit healthcare workers in direct contact with clients to have any forms of artificial nails. Next, remove of all jewelry is recommended. And then next, check hands for breaks in the skin such as hangnails or cuts. If you're washing your hands where the client can observe you, introduce yourself and explain to the client what you're going to do and why it is necessary. Turn on the water and adjust the flow. There are 5 common types of faucet controls. A. Hand operator handles. B. Knee levels. Move this with the knee to regulate flow and temperature. Also, we have foot pedals. Press this with the foot to regulate flow and temperature. And then elbow controls. Move this with your elbows instead of the. And then lastly, infrared control. Motion in front of the sensor causes water to start and stop flowing automatically. Next, wet the hands thoroughly by holding them under the running water and apply soap to the hands. Next, apply the soap and wash, but hold the hands higher than the elbows during this hand wash. Wet the hands and forearms under the running water, letting it run from the fingertips to the elbow so that the hands become clearer than the elbows. If the soap is liquid, apply 4 to 5 ml or 1 tablespoon without touching the bottle. Use your elbow if necessary or have someone to operate this soap bottle for you. In the surgical hand washing, it is advised to use a brush with soap. Wet hands and use soap. Brush is starting from the palm, back of the hands, and forearms in the circular motion. Next, rinse the hand one at a time starting from fingers to elbow. After washing and rinsing, use a towel to dry one hand thoroughly in a rotating motion from the fingers to the elbow. Use a new towel to dry the another hand and arm. Next, turn off the water. Use a new paper towel or grab a hand-operated control or have someone do it for you. Next, place both hands in front of you and keep it above your elbow, ensuring that it touches nothing other than the procedures you're going to perform. Continue with the next procedure if it's surgical, gloving, or gowning. There is no traditional evaluation of the effectiveness of the individual nurse's hand washing.